All right. Thank you so much for joining us today on another episode of Smart Healthcare Podcast. Your host, Chris Darius here. Today, I'm joined by Justin Guajardo, Chief Executive Officer of PAM Health Rehabilitation Hospitals of El Paso. Justin brings a strong leadership perspective in managing hospitals, hospital operations, patient care outcomes, navigating the evolving demands of healthcare infrastructure, and workforce challenges. As a CEO in the rehabilitation space, he's directly involved in shaping how hospitals deliver specialized care while balancing operational efficiency and long-term growth. Thank you so much for joining in today, Justin. In your busy schedule, you actually had a chance to actually have a conversation for us and our audience as well. Just wanted to hop right into the questionnaires that we have for you. What type of priorities as a CEO to balance operational performance and patient outcomes, Justin, currently in PAM Health?
Yeah, so I mean, sometimes there can be some competing priorities going on there, but I think if you focus on the patient outcomes, and what you have to do for that is ensure that you have a good culture here with the clinical staff. And if you support them, give them everything they need to do their job, they feel like they can come to you with issues and you solve their problems. You'll see the clinical outcomes piece come through there, and the operational metrics will kind of take care of themselves at that point. So focusing on the people that are working here, ensuring you've got the top talent, and then retaining them, like I said, by having open door policy, ensuring that they have what they need to do their jobs. And that's basically when I have people come to general hospital orientation as new employees, I'll tell them, I'm here to facilitate. I'm here to ensure that everything that you do makes sense and that you feel comfortable in the work environment and that everybody's acting according to our values that we have here at PAM Health.
Oh, fantastic. In regards of you being in the role of Chief Executive Officer, over the past few years, how has the role of the hospital CEO evolved in the last few years of your tenure?
I'd say that you kind of wear a lot of hats. It's expanded, I think. You have to get involved not only with the hospital day-to-day operations, but more into the community. Reach out with stakeholders. I'd meet with like the local news station, with a lot of physician offices, physician entrepreneurs, because you just got to stay connected, stay relevant to be competitive in the marketplace right now. So I think that I trust my team here more to do, the day-to-day things, deal with any issues that come up within the hospital. So I can spend a lot more of my time in the community, making those connections, so we can make an impact, here in El Paso, and not just for the hospital.
Amazing. In regards of infrastructure and operations, Justin, where do you currently see the biggest gaps in the hospital infrastructure currently in this generation?
What do you mean by that, infrastructure?
Like building up in regards of building wise, like where do you see the biggest gap in regards of hospital infrastructure? Is it like aging infrastructure by implementing the right type of technologies or right type of services? Where are we lacking in regards to it, if you don't mind me asking?
Yeah, so I mean, in the rehab space in particular, where I work in, I mean, the technology is always rapidly changing. And so you have to be very selective when you're bringing on new technology to ensure that it's going to be relevant, have a good lifespan, because a lot of the times it's expensive, and you want to be able to be cost effective when you're choosing, the new equipment. And there's always something new, state of the art coming out. Like we're trying to look at VR technology right now and evaluating if we think that's going to be a good investment this year. And like I said, it's all about the lifespan and the value we can get out of it without it becoming obsolete in a couple of years. A lot of the times, some of the budgeting I think is difficult for people to manage because we have a bottom line we need to reach a lot of time for each month. And so you want to budget some of your capital expenses. You have a $40,000 expense for new equipment, $60,000 expense for new equipment, whatever that might be. And you try to pick a month, the year before to say, okay, I'm doing my budget for next year in November. I'm going to buy this $60,000 piece of equipment in May, and then May comes along and you're not having a good month, right? And so it may not be the best time to do that. So you have to really try to manage everything, to get the outcomes you need financially to keep the hospital open and then also stay relevant with the technology. So that can be, I think, a challenge sometimes.
In regards of like in rehab care, Justin, what design elements most impact patient recovery in your experience that you have seen?
I think it has to do a lot with the training that the therapists have in specialized programs, whether that's like a Parkinson's program, stroke program, brain injury, amputation. There are very specialized treatments, individualized treatments that you need for each of those diagnoses. So having the staff well trained and getting certified in these different areas, I think is most important. And I think if you allow them to do that, you offer that to them, they have more buy-in, they feel more competent doing their job, working with the patient. And I think other than that is just making sure that you have enough staff so that they can provide that one-on-one individualized treatment with each patient instead of some places where they do like group therapy where you don't get as much out of it because you got different people with different diagnoses participating in something at different levels. And like I said, it's just not as effective for the patient's recovery.
In regards of technology wise, like we based on the experience and podcasts that I had with other executives, there's when it comes to like technology industry experts, selecting the technology industry expert is a hard task. Being the CEO of the healthcare organization, when you have to vet a technology industry expert, what are the prime factors that you actually look into when you actually look into some technology industry expert that you would like to implement in the hospital operations?
The main thing I like to look at first is the evidence backing it. Like if there's clinical based evidence that they use to support their technology and also to support the outcomes, like clinical based trials, anything that they've published like that goes a long way. So we can legitimize, the technology and know that it's actually doing what it's supposed to be doing, objectively measured.
In
And then
regards,
outside of that, it's like their willingness to work with us, how they're going to roll out the program, what they're going to offer as far as training for our staff and then their ongoing support to ensure that whatever the technology is going to be updated or like I said, they're going to be continuing to work as we can. We not just buy it and then we never hear from them again, right?
makes sense. Like you would like to build that long-term partnership, like the rapport through and through while you implement it and even after the implementation, right?
Exactly.
Amazing. In regards, when it comes to data points, like there are a lot of data that actually comes from infrastructure, from the building sensors or the components that's installed in the infrastructure, or even the operational, like medical devices and so on and so forth. With your experience itself, how important is real-time data visibility for decision-making process currently in your PAM Health?
Yeah, so we're talking about like monitoring that we use for falls or something like that.
That's right.
Bed alarms and such. Yeah, so I think that you absolutely need real-time information, feedback for patients because, a lot of times a bed alarm, a sensor, whatever it's not, it may not prevent a fall, but it alerts you to it immediately so you can get there and make sure the patient doesn't sustain more damage. So I think that, you need at least some amount of that technology so that the staff can respond in real time. And besides, the fall is probably one of the more minimal things you're talking about, monitoring like a patient that has AFib. And so you want to get a telemonitor on them so that you can make sure they're not having, a heart attack or a stroke based off of the AFib that they're currently diagnosed with and it's not under control yet.
Mhm.
So monitoring that as well as, like O2 sats, you need to know if the patient is not breathing well, they got their oxygen tangled up and it's not flowing anymore. And if you don't have that real time feedback information, the patient's not going to last very long under those circumstances. So it's absolutely vital to have those
Makes
components.
makes sense. In regards of like workforce that who oversees in regards of the team that you have, the staffing, how are you addressing staff challenges while maintaining the quality of the care that you deliver at PAM Health?
Right. So, there's a certain productivity measure we need to meet operationally, right, for nursing and for therapy. And a lot of times that's dictated by the census of the hospital. Sometimes, though, the patients may be very acute or there may be several patients requiring a lot more care than usual. And so we do need to make some adjustments to the staffing whenever those cases come. And I usually trust my clinical leaders to tell me, "Hey, Justin, this is the situation. I know that based off of our productivity measures, we need to have X amount of people, but I need one more person, and this is why." Right. And so we have to adjust sometimes to meet the needs of the patient. And I think overall, we've done a good job here, and it just kind of averages out, and we still meet our productivity measures while adjusting up and down sometimes the staffing that doesn't exactly have to match, like the staffing grid that we have.
So it's like the balanced out in regards to that'll lead to my next question actually. What creates the right environment in regards of PAM health with both staff performance and patient experience?
So I think it's you got to have the dedicated staff and you got to have open door policy so that the staff, like I said, they come to you with their needs, what they're seeing out there on the floor, and they feel comfortable doing that with you, so that the culture is one of trust and that they know that you as a leader are going to support them, and that carries over into the patient experience. I mean, right now we have a program for like getting Google reviews. So we have like an apparel store for PAM with like branded merchandise, sweaters and cups and such. And so I started a program with mostly the therapy staff where, if they can get, say, 5 Google reviews, we'll get them a jacket, a PAM jacket or something like that. And so there's different types of incentives that we try to offer them as well. So, I mean, last month in February, we got 55-star reviews on Google, and a lot of them were generated by the therapists that were incentivized by the program that we started. So giving them that feedback, offering them something they want, and listening. And the reason we started the program is because I met with the team, and we asked them, what would it take for you guys to feel good about working to get these reviews, to be motivated. And this is what came out of it. And it's a win-win for me because they're wearing, the PAM merchandise and using it out, in their regular life now too. So I think it's just advertising, and then we're getting all these Google reviews, which just helps, generate more positive feedback for the hospital.
Oh, that's amazing. So I have three more questions that's more catered towards the future of how you outlook or the future of the hospital. The first question for you is that what major shift will redefine hospital operations in the next 5 to 10 years in your projection?
It's going to have to be regulatory wise, from the federal government changes to CMS reimbursement. Also, I think some sort of revamp of insurance programs like the Medicare Advantage and other commercial insurances, and the way they operate as far as denying patient care or denying even admission to rehab when the patient meets most of the criteria. So I think that there needs to be at least a little bit of change in the way that works, and I think that's likely to happen in the next few years.
Fantastic. And being the leader of the chain, what advice would you give to leaders planning the next generation hospital?
Well, I think that you want to keep an eye on the reimbursement that the government and the regulations that they're providing at different levels of care. So, I mean, for instance, LTAC setting used to be a real good opportunity for people to go in to open up a new long-term acute care hospital. And then the regulations changed to reimbursement, and now the margins just aren't there to even operate an LTAC hospital. And, there's been a whole lot of them that have closed as a result of just that reimbursement change that Medicare, CMS decided to mandate. And I think that that's the biggest thing. You'll see where the opportunity lies. I mean, right now, rehab space is still good. There is some, I think, opportunity in behavioral health, depending if they increase reimbursement in that field, because there's a great need. But it all is going to have to do with the lobbying and what happens in DC for them to make it a viable business. So I think you really got to pay attention to what's coming down the pipeline, and then if you can get ahead of it, and it takes several years, a lot of time to, if you're going to build a hospital, choose what service line you're going to be in. So you got to have to make good decisions and evaluate the current environment, and then pick the service line that is going to be most ideal for the patients, and so you can continue operating as a business.
Fantastic. So one last question in regards to it. What conversations do hospital leaders like yourself need to have right now that's not happening enough based on your observation and experience over the years?
You're talking about just any leadership in the hospital in general, the conversations that need to be happening?
Yes.
I think that interdisciplinary collaboration needs to be talked about a little more. I mean, it's definitely a team game here. And a lot of the times the different disciplines, say nursing, therapy, dietary, they're operating in silos more often than not, and, have not a good understanding of what the other side is doing. And it leads to, like trust issues, little bickering between the departments. And at the end of the day, the patients are the ones who end up suffering for it. So I think that we need to do better about bringing the team together and having them understand. I want the dietary person to know what it's like in the life of a nurse or a therapist and vice versa. A great example of this, we had a CNA, and she actually works in EBS and she works in dietary. So she's come a long way to be able to bridge that gap and explain to, her nursing colleagues, hey, this is what they're doing when they don't answer that text message you sent them, right away. This is what's happening during that time when you feel frustrated that this other department isn't meeting your needs. There's a reason behind that. And I think that's helped build understanding so that, everybody knows that I can trust that, we're all doing the best job we can, and we need to have some understanding, give each other some grace, and then, we can work together better because we know that our colleagues are working just as hard as we are, right?
Yes, definitely. On that note, that concludes all the questions that I have for you today. It's actually a pleasure having you. Of course, we would love to, looking forward to meeting you and your team as well in September, Dallas, Texas. Dates and resources supports during those dates, we would love to have you on board as well. But thank you so much for your time, Justin. It was a pleasure and absolute enjoying talking to you in regards of the operation infrastructure about PAM Health. And thank you so much for your time today.
Absolutely. Anytime. Thank you.
Pleasure.